from National Cancer Centre Singapore, NCCS. I've been practicing as a pharmacist in NCC since I graduated from NUS in 2012. Since then, I started my rotation to the inpatient and outpatient setting, and I stayed on as a pharmacist. And in 2016, I got the opportunity to embark on the pioneer batch of the National Postgraduate Year 1, or otherwise known as PGY1. Subsequently, in 2019, I embarked on my 3-year part-time Doctor of Pharmacy program with NUS. So currently, I'm pursuing my final year of clerkship rotation. So being an outpatient oncology pharmacist for the past 8 years, I've seen the shift in oncology care moving towards the community. This is probably due to the tsunami of new oral chemotherapies being available to our patients. So my role as a pharmacist in NCC has shifted from just merely reviewing of chemotherapy orders as well as patient counselling towards one where I engage the family members and to empower the patients and the family members on self-care in a community setting, ensuring that patients and caregivers are competent enough to provide sufficient self-care and when to seek medical attention. So during this COVID pandemic, I'm challenged to explore the various ways to still provide the same standard of care to them. And I remember at the peak of the pandemic, many of our patients were asked to go back home without their medications, and their new oral chemotherapies were being sent to their home, and they would just await for their medication to be delivered. This greatly posed as a challenge, as I will still have to provide the same amount of counselling to our patients to ensure that they understand. So moving from a face-to-face counselling to telemedicine, where I need to recreate the different methods to deliver the same information and to ensure that patients understand and are taking the right drug and the right dose. So I aspire for the public to gain a greater insight into the various roles of pharmacists, what we play besides just mainly a day-to-day dispensing and counselling at the dispensary counters. So my patients are my driving force, so they keep me going, given the skills and knowledge I'm able to share with my patients, and to empower them to have proper self-care for themselves. So this pandemic did not reshape my passion and my purpose, but rather it has triggered me to rethink about being creative and to think of various delivery methods and approach. I would hope that my patients will see me as somebody as approachable and genuine towards their care. Lastly, as seen during the pandemic, the new model of care that focused on telemedicine did work out indeed. Therefore, I think in the post-COVID era, it continued to trigger outpatient pharmacists like myself to leverage on the available technology or even new technology to redesign our current model of care.